Question 1. The review process indicates a need to evaluate the most effective health promotion and disease prevention strategies for a patient presenting with early signs of metabolic syndrome. Which of the following approaches best aligns with NHA certification standards for patient care and preventive health? Option A. Prescribing a new medication to manage blood pressure and cholesterol levels without discussing significant lifestyle modifications. Option B. Conducting a comprehensive lifestyle assessment, providing personalized education on nutrition and physical activity, and collaboratively developing a realistic action plan with the patient. Option C. Focusing solely on managing the patient's current symptoms and deferring any discussion about long-term lifestyle changes to a future appointment. Option D. Distributing generic pamphlets on healthy eating and exercise, and advising the patient to follow them as best as they can. The correct answer is B. Conducting a comprehensive lifestyle assessment, providing personalized education on nutrition and physical activity, and collaboratively developing a realistic action plan with the patient. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare professional to balance the immediate needs of a patient with the broader, long-term goals of public health and disease prevention. It demands an understanding of various health promotion strategies and their applicability to different patient populations and health conditions, all within the scope of NHA certification guidelines. Careful judgment is required to select the most effective and ethical approach. Correct approach analysis. The correct approach emphasizes a patient-centered, evidence-based strategy that aligns with the principles of health promotion and disease prevention, as taught in NHA certification programs. This involves assessing individual risk factors, providing tailored education, and empowering the patient to make informed decisions about their health. This approach is best professional practice because it respects patient autonomy, promotes adherence to preventive measures, and is consistent with the ethical obligations of healthcare providers to improve patient outcomes and reduce the incidence of preventable diseases. It directly addresses the core competencies expected of NHA-certified professionals in patient education and health counseling. Incorrect approaches analysis. An approach that solely focuses on prescribing medication without addressing lifestyle factors fails to meet the comprehensive requirements of health promotion. This is ethically problematic, as it neglects the patient's active role in their health and may lead to a reliance on pharmacological interventions when behavioral changes could be more effective or complementary. It also misses opportunities for disease prevention beyond symptom management. An approach that relies on generalized public health brochures without personalized assessment or discussion is insufficient. While providing information is a component of health promotion, it lacks the individualized attention necessary to address specific patient concerns, barriers, or readiness to change. This can lead to low engagement and poor outcomes, failing to meet the professional standard of care for patient education. An approach that dismisses the patient's concerns as minor and focuses only on immediate clinical symptoms overlooks the potential for early intervention and prevention. This is ethically unsound, as it fails to provide holistic care and may miss opportunities to prevent the progression of disease or the development of comorbidities. It also fails to uphold the professional responsibility to educate and empower patients. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including their health history, risk factors, and readiness for change. This is followed by the selection of appropriate, evidence-based health promotion and disease prevention strategies that are tailored to the individual patient's needs and circumstances. Effective communication, patient education, and shared decision-making are crucial throughout the process. Professionals must continuously evaluate the effectiveness of their interventions and adapt their approach as needed, always adhering to the ethical principles and regulatory guidelines governing their practice, as emphasized in NHA certification standards. Question 2. The analysis reveals that a healthcare organization is evaluating new electronic health record (EHR) systems to improve patient care coordination and operational efficiency. Which of the following considerations is most critical to ensure regulatory compliance and protect patient privacy under the Health Insurance Portability and Accountability Act (HIPAA)? Option A. Vendor's track record in providing technical support and the system's user-friendly interface for clinical staff. Option B. The system's ability to integrate seamlessly with existing billing software and provide advanced analytics for marketing purposes. Option C, the system's cost-effectiveness and the potential for long-term return on investment for the organization. Option D, the system's robust security features, including encryption, access controls, audit trail, and the vendor's willingness to sign a business associate agreement, BA. The correct answer is B, the system's ability to integrate seamlessly with existing billing software and provide advanced analytics for marketing purposes. Explanation. The analysis reveals a scenario where a healthcare organization is considering adopting a new patient management system. This presents a professional challenge due to the critical need to balance technological advancement with stringent regulatory compliance, particularly concerning patient data privacy and security. The decision-making process requires careful judgment to ensure that any new system not only enhances operational efficiency, but also upholds the organization's legal and ethical obligations under the Health Insurance Portability and Accountability Act, HIPAA. The correct approach involves a thorough assessment of potential systems against HIPAA privacy and security rules. This includes evaluating the system's ability to safeguard protected health information, ensure data integrity, maintain availability, and comply with breach notification requirements. This approach represents best professional practice because it directly addresses the core regulatory mandates designed to protect patient confidentiality and prevent unauthorized access or disclosure of sensitive health data. Adherence to HIPAA is not merely a guideline but a legal requirement, and proactive compliance minimizes the risk of significant financial penalties, reputational damage, and loss of patient trust. An incorrect approach would be to prioritize cost savings or perceived ease of implementation over regulatory compliance. For instance, selecting a system solely based on its lower price point, without verifying its HIPAA compliance features, would be a significant regulatory failure. This overlooks the potential for substantial costs associated with data breaches, fines, and corrective action plans mandated by regulatory bodies. Another incorrect approach would be to assume that a system marketed as HIPAA compliant requires no further vetting. This is a failure to exercise due diligence, as compliance is an ongoing responsibility that necessitates verification and ongoing monitoring. Relying on vendor assurances without independent verification can lead to overlooking critical vulnerabilities. Furthermore, implementing a system without adequate staff training on its privacy and security protocols would also constitute a regulatory and ethical failure, as it increases the likelihood of accidental breaches due to user error. The professional decision-making process for similar situations should involve a multidisciplinary team including IT, compliance officers, legal counsel, and clinical staff. This team should establish clear criteria for system evaluation, prioritizing regulatory adherence, data security, and patient privacy. A risk assessment should be conducted for each potential system, identifying potential vulnerabilities and mitigation strategies. Vendor due diligence is paramount, requiring detailed review of their security practices, certifications, and willingness to enter into a business associate agreement, BA, where applicable. Finally, ongoing training and auditing are essential to ensure continued compliance after implementation. Question 3. Benchmark analysis indicates that adherence to infection control practices is a critical component of patient safety and professional competency, as assessed by NHA certifications. A certified healthcare professional is assigned to assist a patient with personal care, which involves tasks that carry a risk of exposure to bodily fluids. The professional experiences significant personal discomfort with wearing gloves, finding them to be cumbersome and intrusive. However, established protocols and NHA guidelines clearly mandate the use of gloves for such procedures. What is the most appropriate course of action for the professional in this situation? Option A. Wear the mandated gloves for the duration of the patient care task, ensuring proper donning and doffing techniques are followed. Option B. Wear gloves for the entire patient encounter and then use them to handle personal items before changing them. Option C. Refuse to wear gloves, citing personal discomfort, and proceed with the care task without them. Option D. Wear gloves only when visibly soiled, as personal comfort is a priority for effective patient interaction. The correct answer is A. Wear the mandated gloves for the duration of the patient care task, ensuring proper donning and doffing techniques are followed. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in healthcare settings where a healthcare professional's personal beliefs or comfort level may conflict with established infection control protocols designed to protect patients and staff. The challenge lies in balancing individual autonomy with the paramount responsibility of patient safety and adherence to regulatory standards. The professional must navigate this conflict while maintaining a therapeutic relationship and ensuring no compromise to infection prevention. Correct approach analysis. The correct approach prioritizes patient safety and adherence to NHA-mandated infection control standards. This involves utilizing appropriate personal protective equipment, PPE, as indicated by the situation, regardless of personal preference. NHA certifications emphasize the importance of universal precautions and standard precautions, which include the correct use of PPE to prevent the transmission of infectious agents. This approach aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also directly reflects the regulatory framework that NHA certifications are based upon, which mandates specific infection control practices to ensure a safe healthcare environment. Incorrect approaches analysis. One incorrect approach involves refusing to wear gloves when indicated for patient care, citing personal discomfort. This directly violates standard precautions and NHA guidelines, creating a significant risk of pathogen transmission to both the patient and the healthcare professional. This failure constitutes a breach of professional responsibility and potentially violates regulations concerning workplace safety and patient care standards. Another incorrect approach is to wear gloves for the entire duration of patient contact, even when not directly interacting with bodily fluids or contaminated surfaces, and then touching personal items like a phone or charting device without changing them. This demonstrates a misunderstanding of proper glove use and hand hygiene protocols. Gloves are a barrier, not a substitute for hand hygiene, and their improper use can lead to cross-contamination, undermining the very purpose of infection control. This reflects a failure to adhere to NHA-emphasized best practices for preventing healthcare-associated infections. A third incorrect approach is to only wear gloves when visibly soiled, ignoring the need for them during procedures that may involve unseen contamination. This is a critical failure in understanding the principles of standard precautions, which assume all bodily fluids are potentially infectious. NHA certification training stresses the importance of proactive infection control measures, not reactive ones based solely on visible contamination. This approach significantly increases the risk of transmission and is a direct contravention of established infection control protocols. Professional reasoning. Professionals should approach such situations by first recalling their training and the established protocols for infection control, as emphasized by their NHA certification. When faced with a conflict, the immediate priority is patient safety and adherence to regulatory requirements. If personal discomfort or beliefs interfere with these mandates, the professional should seek guidance from a supervisor or consult relevant policy documents. The decision-making process should always be guided by evidence-based practices and regulatory compliance, ensuring that patient well-being is never compromised. Question 4. Process analysis reveals that a healthcare professional is reviewing a patient's chart and encounters the term nephritis. To accurately document and communicate the patient's condition, the professional must correctly deconstruct this medical term, which breakdown and interpretation of the word parts accurately defines nephritis according to standard medical terminology principles relevant to NHA certifications. Option A. Root, nephr, kidney. Prefix ni not, suffix itis, inflammation, meaning not inflamed kidney. Option B. Suffix itis, inflammation, meaning inflammation. Option C. Root, nephr, kidney, suffix itis, inflammation, meaning inflammation of the kidney. Option D. Root, nephr, kidney, suffix itis, infection, meaning infection of the kidney. Correct answer is C. Root, nephr, kidney, suffix itis, inflammation, meaning inflammation of the kidney. Explanation, scenario analysis. This scenario is professionally challenging because accurate interpretation of medical terminology is fundamental to patient care, documentation, and billing within the healthcare system governed by NHA certifications. Misinterpreting word parts can lead to incorrect charting, miscommunication between healthcare providers, and potentially inappropriate treatment or billing, all of which have regulatory implications under NHA guidelines for maintaining professional standards. Correct approach analysis. The The correct approach demonstrates a thorough understanding of medical word parts, specifically the root, prefix, and suffix, and their combined meaning. This aligns with NHA's emphasis on accurate medical knowledge and documentation. By correctly identifying nepher as the root for kidney, itis as the suffix for inflammation, and nepher as the root for kidney, the professional accurately deciphers the term nephritis as inflammation of the kidney. This precision is essential for compliant patient record-keeping and communication, as mandated by NHA standards for certified healthcare professionals. Incorrect approach is analysis, an approach that focuses solely on the suffix itis, without considering the root word, fails to grasp the complete meaning of the medical term. This leads to an incomplete and potentially misleading understanding, which is a failure in applying the core principles of medical terminology taught and assessed by NHA. It risks miscommunication and incorrect documentation. An approach that incorrectly identifies the root word or suffix, or assigns a meaning unrelated to the anatomical structure or pathological process, represents a fundamental misunderstanding of medical word parts. This directly violates NHA's requirement for accurate knowledge and application of medical terminology, potentially leading to significant errors in patient care and documentation, which could have regulatory consequences. An approach that attempts to guess the meaning based on context without breaking down the word parts demonstrates a lack of systematic knowledge. While context can sometimes aid understanding, relying on it solely for medical terminology is unprofessional and prone to error, contravening NHA's expectation of foundational knowledge in word part analysis. Professional reasoning. Professionals should employ a systematic approach to medical terminology by first identifying the root word, then the prefix if present, and finally the suffix if present. Each component should be analyzed for its specific meaning, and then synthesized to form the overall meaning of the term. This methodical breakdown ensures accuracy and reduces the likelihood of misinterpretation, which is critical for compliance with NHA certification standards and for providing safe, effective patient care. Question 5. During the evaluation of a patient's electronic health record, a healthcare professional encounters the abbreviation PRN in a medication order. The professional is unsure of its precise meaning in this context. Which of the following actions best demonstrates adherence to NHA certification standards for patient care and documentation? Option A. Consult a current, approved list of medical abbreviations maintained by the healthcare facility or a recognized professional organization. Option B. Infer the meaning of PRN based on the patient's current condition and other medications listed in the chart. Option C. Ask a colleague for their interpretation of the abbreviation, assuming they are likely to know. Option D. Rely on personal recollection of the abbreviation's meaning from previous training or experience. Correct answer is A. Consult a current, approved list of medical abbreviations maintained by the healthcare facility or a recognized professional organization. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where the accurate interpretation of medical documentation is paramount for patient safety and continuity of care. Misinterpreting abbreviations can lead to medication errors, incorrect diagnoses, or inappropriate treatment plans. The professional challenge lies in ensuring that all healthcare professionals involved in patient care understand and correctly apply the meaning of medical abbreviations, especially when variations or non-standard abbreviations might be encountered. Adherence to established guidelines and protocols is crucial to mitigate these risks. Correct approach analysis. The correct approach involves referencing a current, approved, and readily accessible list of medical abbreviations. This aligns with NHA's emphasis on standardized practices and patient safety. Regulatory frameworks and best practice guidelines for healthcare professionals consistently advocate for the use of standardized terminology to prevent miscommunication. By consulting an approved list, the healthcare professional ensures they are using the most accurate and universally accepted meaning of the abbreviation, thereby upholding professional standards and minimizing the risk of error. This practice directly supports the NHA's commitment to competent and safe healthcare delivery. Incorrect approach is analysis. Assuming the meaning of an unfamiliar abbreviation without verification is a significant regulatory and ethical failure. It bypasses established protocols for ensuring accuracy and introduces a high risk of error, which can have severe consequences for patient care. This approach violates the principle of due diligence and professional responsibility. Relying on personal memory or informal knowledge for critical medical information is unreliable and unprofessional. Furthermore, guessing the meaning based on context alone, while sometimes seemingly effective, is inherently risky and does not meet the standard of care required in healthcare. It fails to adhere to the principle of using verified information, which is a cornerstone of safe medical practice and a key expectation for NHA-certified professionals. Professional reasoning. When encountering an unfamiliar medical abbreviation, the professional decision-making process should always prioritize patient safety and accuracy. The first step is to recognize the potential for misinterpretation. The next step is to actively seek clarification through reliable sources. This includes consulting official facility policy and procedure manuals, approved medical dictionaries, or reputable online medical databases that are recognized within the healthcare setting. If clarification cannot be immediately obtained from these sources, the professional should err on the side of caution and seek direct clarification from the ordering provider or a supervisor. The overarching principle is to never assume, always verify, and to prioritize the patient's well-being above all else. Question 6. The risk matrix shows a moderate probability of misinterpretation when a healthcare provider uses the term dyspnea without further context. A medical assistant encounters this term in a patient's chart and is unsure if it refers to mild shortness of breath or a more severe respiratory distress. What is the most appropriate course of action to ensure accurate patient care and documentation? Option A. Document the term dyspnea as mild shortness of breath, as this is a common interpretation. Option B. Make a note in the chart that the term dyspnea was used without further clarification. Option C. Proceed with standard patient care protocols for shortness of breath without further inquiry. Option D. Seek immediate clarification from the ordering healthcare provider regarding the specific nature of the dyspnea. The correct answer is D. Seek immediate clarification from the ordering healthcare provider regarding the specific nature of the dyspnea. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for miscommunication and patient harm stemming from a misunderstanding of medical terminology. The healthcare professional is faced with a situation where their interpretation of a patient's condition, based on potentially ambiguous terminology, could lead to incorrect treatment or documentation. This requires careful judgment to ensure accurate understanding and appropriate action, upholding patient safety and professional integrity. Correct approach analysis. The correct approach involves seeking clarification from the healthcare provider who used the term. This aligns with NHA's emphasis on patient safety and accurate record keeping. By directly addressing the ambiguity, the professional ensures they have a precise understanding of the patient's diagnosis or symptom, which is crucial for correct charting, billing, and subsequent care. This proactive communication prevents errors and upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to guidelines promoting clear and concise medical documentation. Incorrect approaches analysis. Assuming the meaning of the term without verification is professionally unacceptable because it introduces a high risk of misinterpretation. This could lead to incorrect medical record entries, inappropriate treatment plans, and potentially adverse patient outcomes, violating the principle of non-maleficence. It also demonstrates a lack of diligence in ensuring accurate information, which is a cornerstone of professional healthcare practice. Documenting the term as understood without confirmation is also professionally unacceptable. Medical records are legal documents, and inaccuracies can have serious consequences for patient care, billing, and legal proceedings. This approach bypasses the opportunity to ensure accuracy and could lead to a cascade of errors based on a flawed initial understanding. Ignoring the ambiguity and proceeding with a general understanding is professionally unacceptable, as it fails to address the root of the potential problem. This passive approach neglects the responsibility to ensure clarity and accuracy in patient care, potentially leading to the same negative outcomes as assuming the meaning. It demonstrates a lack of commitment to the highest standards of patient safety and professional accountability. Professional reasoning. Professionals should employ a systematic approach when encountering ambiguous medical terminology. This involves 1. Recognizing the ambiguity. 2. Prioritizing patient safety and accuracy. 3. Proactively seeking clarification from the source of the information. 4. Documenting the clarified information accurately. 5. If clarification is impossible, documenting the ambiguity and the steps taken to resolve it, while proceeding with the most conservative and safest course of action. This decision-making process emphasizes clear communication, critical thinking, and a commitment to ethical practice. Question 7. The assessment process reveals a patient presenting with symptoms that are beyond the scope of routine primary care, but do not immediately suggest a life-threatening emergency requiring immediate tertiary intervention. The patient expresses concern about the complexity of their condition and asks for the most direct route to specialized treatment. As an NHA certified professional, what is the most appropriate initial action to ensure the patient receives timely and effective care within the established healthcare delivery model? Option A. Instruct the patient to return to primary care for further observation and management of their symptoms. Option B. Refer the patient to the appropriate secondary care specialist after a thorough assessment and documentation of the need for specialized evaluation. Option C. Bypass standard referral protocols and directly contact a tertiary care facility for an unscheduled appointment. Option D. Advise the patient to seek immediate tertiary care to ensure all potential complex issues are addressed promptly. The correct answer is B. Refer the patient to the appropriate secondary care specialist after a thorough assessment and documentation of the need for specialized evaluation. Explanation. This scenario presents a professional challenge because it requires a healthcare professional to accurately identify the appropriate level of care for a patient based on their presenting symptoms and the established healthcare delivery model. Misclassifying a patient's needs can lead to delays in receiving necessary treatment, inappropriate resource allocation, and potential negative patient outcomes, all of which have implications for professional accountability and adherence to healthcare standards. The correct approach represents best professional practice because it aligns with the fundamental principles of healthcare delivery as defined by the National Health Career Association, NHA certifications. Primary care focuses on initial diagnosis, treatment of common illnesses, and preventive care. Secondary care involves specialized services that require referral from primary care. Tertiary care is highly specialized, often involving complex procedures and advanced diagnostics. Accurately assessing the patient's condition and directing them to the most appropriate level of care ensures efficient and effective utilization of healthcare resources, patient safety, and adherence to the scope of practice expected of NHA-certified professionals. This also upholds ethical obligations to provide patient-centered care. An incorrect approach that directs a patient with symptoms indicative of a potential secondary care need to only primary care would fail to recognize the limitations of primary care in addressing more complex conditions. This could result in delayed diagnosis and treatment, potentially worsening the patient's condition and violating the ethical duty to provide timely and appropriate care. Furthermore, it could be seen as a failure to adhere to established referral pathways, which are implicitly part of the regulatory framework governing healthcare delivery. Another incorrect approach, such as immediately referring a patient with a common, self-limiting condition to tertiary care, represents a significant misallocation of resources. This overutilization of specialized services strains the healthcare system, increases costs, and can lead to longer wait times for patients who genuinely require tertiary-level interventions. This demonstrates a lack of understanding of the tiered structure of healthcare delivery and a failure to act as a responsible steward of healthcare resources, which is a core expectation for NHA-certified professionals. Finally, an approach that bypasses established referral processes and directly accesses specialized services without appropriate justification would also be professionally unacceptable. This undermines the coordinated care model, can lead to fragmented care, and may violate specific NHA guidelines or state regulations regarding patient navigation and referral protocols. The professional decision-making process for similar situations should involve a systematic assessment of the patient's chief complaint, a thorough review of their medical history and current symptoms, and an understanding of the capabilities and limitations of each tier of the healthcare delivery model. Professionals should ask, does this patient's condition require initial assessment and management, specialized consultation, or highly complex intervention? This systematic evaluation, guided by established clinical protocols and NHA standards, ensures that patients receive the most appropriate and efficient level of care. Question 8. Regulatory review indicates a potential breach in sterile processing protocols for surgical instruments, leading to a suspected increase in post-operative infections, which regulatory agencies' oversight is most directly implicated, and what is the primary function of that agency in this context? Option A. The Food and Drug Administration, FDA, is implicated as it regulates the safety and effectiveness of medical devices, including the sterilization processes and equipment used for surgical instruments. Option B. The Centers for Medicare and Medicaid Services, CMS, is implicated as it sets quality of care standards for facilities receiving federal funding, and infection rates impact patient outcomes. Option C. The Occupational Safety and Health Administration, OSHA, is implicated as it oversees workplace safety, and sterile processing staff may be exposed to hazardous chemicals during cleaning. Option D. The Environmental Protection Agency, EPA, is implicated as it regulates the disposal of biohazardous waste generated during surgical procedures. The correct answer is A. The Food and Drug Administration, FDA, is implicated as it regulates the safety and effectiveness of medical devices, including the sterilization processes and equipment used for surgical instruments. Explanation: this scenario presents a professional challenge because healthcare facilities must navigate a complex web of regulatory requirements to ensure patient safety and compliance. Centers for Medicare and Medicaid Services, CMS, sets standards for quality of care and patient rights for facilities receiving Medicare and Medicaid funding. The Food and Drug Administration, FDA, regulates the safety and efficacy of medical devices and pharmaceuticals. The Occupational Safety and Health Administration, OSHA, establishes standards to protect workers from workplace hazards. A failure to understand and apply the distinct functions of these agencies can lead to significant penalties, patient harm, and compromised worker safety. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of how to address a potential regulatory violation by engaging the appropriate agency based on the nature of the issue. This proactive and informed engagement ensures that the facility is working within the established legal and ethical frameworks governing healthcare operations. It prioritizes patient safety and worker well-being by seeking expert guidance and implementing corrective actions as dictated by the relevant regulatory body. An incorrect approach that focuses solely on internal policy without considering external regulatory mandates fails to acknowledge the legal obligations of the facility. This could lead to continued noncompliance and potential harm. Another incorrect approach that contacts an agency irrelevant to the specific issue wastes resources and delays resolution, potentially exacerbating the problem and demonstrating a lack of understanding of regulatory responsibilities. Finally, an approach that ignores the issue entirely represents a severe ethical and regulatory failure, risking patient safety, worker well-being, and legal repercussions. Professionals should employ a systematic decision-making process when encountering potential regulatory issues. This involves 1. Accurately identifying the nature of the problem, e.g., patient care quality, device malfunction, workplace safety hazard. 2. Determining which regulatory agency's purview the issue falls under based on its specific function. 3. Consulting relevant regulations and guidelines from that agency. 4. Developing and implementing a corrective action plan in consultation with the agency, if necessary. 5. Documenting all actions taken and maintaining ongoing compliance. Question 9. The performance metrics show a consistent decline in patient satisfaction scores within a specific unit, correlating with an increase in reported instances of medication administration errors. As a certified healthcare professional in this unit, what is the most appropriate initial action to address this situation? Option A. Request a meeting with your direct supervisor and relevant team leads to discuss the performance metrics. Explore potential contributing factors related to workflow and role clarity, and propose a collaborative review of interprofessional responsibilities. Option B. Continue with your daily duties as usual, assuming the performance metrics are temporary fluctuations and will resolve on their own without intervention. Option C. Focus on meticulously double-checking your own medication administrations and patient interactions, assuming the issues are isolated to individual performance. Option D. Immediately document your concerns about the performance metrics and medication errors in a formal complaint to the facility's accreditation body, citing potential systemic failures. The correct answer is A. Request a meeting with your direct supervisor and relevant team leads to discuss the performance metrics, explore potential contributing factors related to workflow and role clarity, and propose a collaborative review of interprofessional responsibilities. Explanation. This scenario presents a professional challenge because it requires a healthcare professional to interpret performance data and its implications for interprofessional collaboration and workforce effectiveness within the specific regulatory and ethical framework of NHA certifications. The core of the challenge lies in identifying the most appropriate response to a systemic issue that impacts patient care and team dynamics, demanding a solution that aligns with NHA's emphasis on patient safety, ethical conduct, and efficient healthcare delivery. The correct approach represents best professional practice because it directly addresses the root cause of the performance metric deviation by advocating for a collaborative review of workflows and role clarity. This aligns with NHA's focus on interprofessional collaboration, which is crucial for optimizing patient care and ensuring that all members of the healthcare team understand their responsibilities and how they contribute to the overall care plan. By initiating a discussion with supervisors and relevant team members, the professional demonstrates proactive problem solving and a commitment to improving team efficiency and patient outcomes, adhering to ethical principles of accountability and continuous quality improvement. An incorrect approach that focuses solely on individual performance without considering systemic factors fails to acknowledge the interconnectedness of the healthcare team. This overlooks the potential for miscommunication, unclear roles, or inefficient processes that could be contributing to the performance metrics. Ethically, it can lead to unfair blame and does not foster a supportive team environment, which is contrary to the principles of collaborative care emphasized by NHA. Another incorrect approach that involves bypassing established communication channels to report concerns to external bodies without first attempting internal resolution is premature and unprofessional. This can undermine team cohesion and damage professional relationships. Ethically, it violates the principle of escalating issues through appropriate hierarchical structures and can be seen as a failure to attempt to resolve problems collaboratively within the organization. A third incorrect approach that involves ignoring the performance metrics and continuing with existing practices is a direct failure to uphold professional responsibility. NHA certifications imply a commitment to quality care and continuous improvement. Ignoring data that suggests a problem is a dereliction of duty and can have negative consequences for patient safety and organizational effectiveness. Ethically, this demonstrates a lack of accountability and a disregard for the principles of evidence-based practice and patient advocacy. The professional decision-making process for similar situations should involve 1. Objectively analyzing the performance data to identify potential contributing factors. 2. Considering the roles and responsibilities of all involved team members. 3. Initiating open and constructive communication with supervisors and colleagues to discuss findings and brainstorm solutions. 4. Advocating for collaborative process improvements that enhance efficiency and patient care, ensuring alignment with NHA standards for ethical practice and interprofessional collaboration. Question 10. The efficiency study reveals that during a simulated cardiac arrest scenario, a certified healthcare professional must make a critical decision regarding the immediate course of action. The patient is unresponsive and not breathing normally. Which of the following actions best reflects the immediate, protocol-driven response expected of an NHA-certified professional in this emergency situation? Option A. Immediately begin chest compressions and prepare for defibrillation if available, while simultaneously directing another person to call for advanced medical help. Option B. Attempt to locate and consult with the facility's medical director before intervening. Option C. Pause to thoroughly document the patient's vital signs before initiating any emergency procedures. Option D. Administer a prescribed medication to the patient, assuming a cardiac event, before checking for responsiveness or breathing. The correct answer is A. Immediately begin chest compressions and prepare for defibrillation if available, while simultaneously directing another person to call for advanced medical help. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, life-saving intervention in a high-stress environment where the patient's condition is rapidly deteriorating. The healthcare professional must balance the urgency of the situation with the need to follow established protocols and maintain patient dignity. The potential for legal repercussions, ethical dilemmas, and the direct impact on patient outcomes necessitates a calm, decisive, and protocol-driven response. Correct approach analysis. The correct approach prioritizes immediate, effective intervention based on established emergency protocols. This aligns with NHA certification standards, which emphasize the importance of recognizing and responding to medical emergencies promptly and competently. Following the chain of survival, which includes early CPR and defibrillation, is a cornerstone of emergency care and is directly supported by NHA curriculum. This approach demonstrates adherence to professional standards of care, ethical obligations to provide aid, and regulatory requirements for emergency preparedness within healthcare settings. Incorrect approach is analysis. One incorrect approach involves delaying care to consult with a supervisor or seek additional personnel before initiating basic life support. This violates the principle of immediate intervention in a life-threatening situation. Regulatory frameworks, including those emphasized by NHA, mandate that certified professionals act decisively in emergencies. Delaying CPR can lead to irreversible brain damage or death, representing a failure to meet the standard of care and potentially violating ethical duties. Another incorrect approach is to administer care without first assessing the scene for safety. While speed is critical, ensuring personal safety and the safety of others is a prerequisite for effective intervention. Failure to do so could result in further harm to the rescuer and bystanders, compromising the overall emergency response and potentially leading to liability. This overlooks a fundamental aspect of emergency preparedness taught in NHA certifications. A third incorrect approach is to perform CPR without considering the patient's potential underlying condition or attempting to gather information if possible, even briefly. While immediate CPR is paramount, a quick assessment for obvious signs of trauma or other immediate threats that might influence the approach, e.g., spinal precautions, is part of a comprehensive emergency response. However, this is secondary to initiating CPR if the patient is unresponsive and not breathing normally. Overlooking this, while less critical than delaying CPR, can still represent a less than optimal application of emergency protocols. Professional reasoning. Professionals should employ a systematic approach to emergency situations, often referred to as the DRSAPT or similar mnemonics, which guides them through scene assessment, checking for responsiveness, opening the airway, checking for breathing, calling for help, and initiating CPR and defibrillation. This structured decision-making process ensures that critical steps are not missed, even under pressure. It emphasizes prioritizing immediate life-saving interventions, while also considering safety and the broader emergency response. Question 11. Implementation of accurate pharmacological terminology in patient charting is paramount for effective communication and patient safety. A patient is prescribed a medication that inhibits the action of a specific enzyme. Which of the following terms best describes this mechanism of action? Option A, potentiator. Option B, synergist. Option C, antagonist. Option D, agonist. The correct answer is C, antagonist. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare professional to accurately interpret and apply pharmacological terminology in a real-world patient care context. Misunderstanding or misapplying these terms can lead to medication errors, patient harm, and regulatory noncompliance. The pressure to quickly and accurately document patient information necessitates a strong foundational knowledge of pharmacology. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying and utilizing the most precise pharmacological term to describe the patient's condition and prescribe treatment. This precision is crucial for clear communication among healthcare providers, accurate record keeping, and ensuring patient safety, aligning with NHA's emphasis on competent and safe patient care practices. Adherence to standardized terminology, as promoted by NHA, minimizes ambiguity and potential for error. Incorrect approach is analysis. An approach that uses a vague or imprecise term fails to meet professional standards by introducing ambiguity. This can lead to misinterpretation by other healthcare professionals, potentially resulting in incorrect medication administration or treatment adjustments, which violates the NHA's core principle of patient safety and accurate documentation. An approach that uses a term that is not pharmacologically accurate, even if it sounds similar, represents a significant failure. This demonstrates a lack of fundamental knowledge and can lead to serious medication errors, directly contravening NHA's mandate for qualified and knowledgeable healthcare professionals. Such an error could have legal and ethical ramifications. An approach that uses a layperson's term instead of the appropriate medical or pharmacological terminology is unprofessional and can lead to miscommunication. While understandable to the patient, it is insufficient for professional medical charting and communication, potentially leading to misunderstandings among the healthcare team and compromising the continuity of care, which is a key focus of NHA certification. Professional reasoning. Professionals should approach pharmacological terminology with a commitment to precision and accuracy. This involves 1. Understanding the specific meaning of each term. 2. Consulting reliable resources, e.g., drug references, medical dictionaries, when unsure. 3. Prioritizing clarity and conciseness in documentation. 4. Recognizing the potential impact of terminology on patient safety and care coordination. 5. Continuously updating knowledge to reflect current pharmacological understanding. Question 12. Process analysis reveals that a healthcare facility is considering implementing a new telehealth platform to expand remote patient monitoring services. The platform promises enhanced data collection and real-time alerts for critical patient conditions. However, the facility's current patient care protocols are designed for in-person interactions, and there are concerns about how this new technology will integrate with existing electronic health record (EHR) systems and ensure patient privacy under HIPAA. Which of the following represents the most appropriate approach for the healthcare facility to adopt? Option A. Immediately deploy the telehealth platform to all eligible patients, assuming that the advanced technology will inherently improve care and that existing protocols can be adapted post-implementation. Option B. Develop a comprehensive integration plan that outlines how the telehealth platform will align with existing patient care protocols, EHR systems, and HIPAA compliance requirements, including staff training and patient consent procedures. Option C. Implement the telehealth platform for a select group of tech-savvy patients who have expressed interest, without a formal integration plan, to gauge initial reception and address any issues as they arise. Option D. Prioritize the technological capabilities of the platform, focusing on data collection, and instruct clinical staff to manually transcribe relevant data into the EHR, bypassing direct integration to avoid initial technical complexities. The correct answer is B. Develop a comprehensive integration plan that outlines how the telehealth platform will align with existing patient care protocols, EHR systems, and HIPAA compliance requirements, including staff training and patient consent procedures. Explanation. This scenario presents a common challenge in healthcare systems where the integration of new technologies must align with established patient care protocols and regulatory compliance. The professional challenge lies in balancing the potential benefits of innovation with the imperative to maintain patient safety, privacy, and equitable access to care, all within the framework of NHA certification standards and relevant U.S. healthcare regulations. Careful judgment is required to ensure that technological adoption enhances, rather than compromises, the quality and accessibility of healthcare services. The correct approach prioritizes patient well-being and adherence to established healthcare delivery models. It involves a systematic evaluation of how the new telehealth platform integrates with existing patient care pathways, ensuring that it complements, rather than disrupts, the continuity of care. This approach aligns with the NHA's emphasis on competent and ethical healthcare practice, which inherently includes understanding and operating within the established structures of the U.S. healthcare system. It also implicitly addresses regulatory considerations, such as HIPAA compliance for patient data privacy, and the ethical obligation to provide care that is both effective and accessible. An incorrect approach that focuses solely on the technological advancement without considering its integration into the existing healthcare structure, fails to acknowledge the complex interdependencies within patient care. This could lead to fragmented care, potential patient safety risks if protocols are not adapted, and non-compliance with regulations governing patient records and communication. Another incorrect approach that bypasses established communication channels and patient consent procedures directly violates ethical principles of patient autonomy and privacy, and could lead to regulatory penalties under HIPAA. A third incorrect approach that assumes the technology will automatically improve outcomes without a structured evaluation risks inefficient resource allocation and may not address the actual needs of the patient population or the operational realities of the healthcare facility. Professionals should employ a decision-making process that begins with understanding the core objectives of the new technology and its intended impact on patient care. This should be followed by an assessment of how it fits within the current healthcare system's infrastructure, workflows, and regulatory environment. Collaboration with relevant stakeholders, including IT, clinical staff, and compliance officers, is crucial. A thorough risk assessment, considering patient safety, data security, and accessibility, should guide implementation. Finally, ongoing evaluation and adaptation are necessary to ensure the technology effectively serves its purpose and remains compliant with evolving standards and regulations. Question 13. Operational review demonstrates that a healthcare facility is experiencing an increase in patient falls and near misses related to medication administration errors. To address these issues, the facility is considering several new protocols. Which of the following approaches best aligns with NHA-aligned patient safety standards for fall prevention and medication safety? Option A. Implementing a mandatory, facility-wide patient education program on fall risks and medication adherence, coupled with a standardized fall risk assessment tool used upon admission and with any change in patient condition, and a robust medication reconciliation process at all transition points of care. Option B. Introducing a new electronic health record alert system for medication interactions, but discontinuing routine medication reconciliation for patients who have been in the facility for more than 48 hours. Option C. Relying on experienced staff to identify patients at high risk for falls based on their intuition, and to verbally remind patients about medication schedules without formal documentation. Option D. Focusing solely on environmental modifications, such as increasing lighting and removing clutter, while assuming patients will report any discomfort or side effects from their medications. Correct answer is A. Implementing a mandatory, facility-wide patient education program on fall risks and medication adherence, coupled with a standardized fall risk assessment tool used upon admission and with any change in patient condition, and a robust medication reconciliation process at all transition points of care. Explanation. This scenario presents a common challenge in healthcare settings, balancing efficient workflow with the paramount importance of patient safety, specifically concerning fall prevention and medication safety. The professional challenge lies in identifying and implementing protocols that are both effective and compliant with NHA certification standards, which are rooted in U.S. federal and state healthcare regulations. Careful judgment is required to discern between practices that enhance safety and those that may inadvertently introduce risk or fall short of regulatory expectations. The correct approach prioritizes a multifaceted strategy that integrates patient assessment, environmental modifications, and meticulous medication administration. This aligns with best professional practice by adhering to established patient safety guidelines and regulatory mandates, such as those promoted by organizations like the Joint Commission and reflected in NHA curriculum. These guidelines emphasize proactive risk identification, patient education, and a culture of safety, all of which are crucial for preventing falls and ensuring medication accuracy. An incorrect approach that relies solely on anecdotal evidence or assumes patient compliance without verification fails to meet regulatory requirements for evidence-based practice and patient advocacy. This could lead to regulatory noncompliance, increased patient harm, and potential legal ramifications. Another incorrect approach that bypasses established medication reconciliation procedures, even for seemingly minor changes, introduces a significant risk of medication errors, contravening federal regulations like those enforced by CMS and the FDA, which mandate strict medication safety protocols. A third incorrect approach that neglects to document interventions or patient responses leaves a gap in the patient's record, hindering continuity of care and making it difficult to assess the effectiveness of safety measures, which is a fundamental requirement of healthcare documentation standards. Professionals should employ a decision-making framework that begins with a thorough understanding of patient-specific risks, followed by the implementation of evidence-based intervention. This involves continuous assessment, clear communication with the patient and care team, and meticulous adherence to established protocols for medication administration and environmental safety. When faced with deviations or potential risks, professionals must consult relevant policies, seek guidance from supervisors, and document all actions and observations thoroughly, ensuring alignment with NHA-aligned patient safety standards. Question 14. The evaluation methodology shows a healthcare professional is caring for a patient who expresses reluctance to undergo a standard diagnostic procedure due to deeply held religious beliefs that prohibit certain bodily interventions. The professional needs to determine the most appropriate course of action to ensure both patient well-being and adherence to ethical standards. Which of the following actions best demonstrates cultural competence and professional responsibility in this situation? Option A. Proceed with the diagnostic procedure as scheduled, explaining that medical necessity overrides personal beliefs in a healthcare setting. Option B. Gently inquire about the specific nature of the religious beliefs and how they relate to the procedure, explaining the medical necessity and exploring if any accommodations or alternative approaches are acceptable to the patient and medically feasible. Option C. Inform the patient that their beliefs are not compatible with receiving care at this facility and suggest they seek care elsewhere. Option D. Politely but firmly explain that while their beliefs are understood, the procedure is mandatory for their health and they must comply. The correct answer is B. Gently inquire about the specific nature of the religious beliefs and how they relate to the procedure, explaining the medical necessity and exploring if any accommodations or alternative approaches are acceptable to the patient and medically feasible. Explanation. This scenario presents a common challenge in healthcare settings, navigating diverse patient backgrounds and ensuring equitable, respectful care. The professional challenge lies in balancing the patient's expressed beliefs and practices with the healthcare provider's duty to provide effective and safe treatment, all while adhering to NHA's ethical and professional standards, which implicitly require culturally competent care. Careful judgment is required to avoid imposing personal beliefs or making assumptions that could alienate or harm the patient. The correct approach represents best professional practice because it prioritizes open communication, active listening, and patient-centered care. By asking clarifying questions and seeking to understand the patient's perspective, the healthcare professional demonstrates respect for their cultural beliefs and values. This aligns with NHA's commitment to ethical patient care, which emphasizes dignity, respect, and informed consent. Understanding the patient's cultural context allows for the development of a care plan that is not only medically sound, but also culturally acceptable and more likely to be followed, leading to better health outcomes. This approach avoids stereotyping and fosters trust, which are foundational to the patient-provider relationship. An incorrect approach that involves dismissing the patient's concerns or proceeding with care without understanding their beliefs is professionally unacceptable. This demonstrates a lack of cultural competence and can lead to patient distrust, non-adherence to treatment, and potentially adverse health outcomes. Ethically, it violates the principle of respect for autonomy and can be seen as discriminatory. Another incorrect approach, such as imposing one's own cultural or religious beliefs onto the patient, is a direct violation of professional boundaries and ethical standards. Healthcare professionals are expected to remain neutral and provide care based on medical necessity and patient preference, not personal conviction. This can lead to a breakdown in the therapeutic relationship and legal repercussions. Forcing a patient to choose between their beliefs and necessary medical care without exploring alternatives is also ethically problematic, as it fails to uphold the patient's right to make informed decisions about their health. Professionals should employ a decision-making framework that begins with recognizing and acknowledging potential cultural differences. This is followed by active listening and open-ended questioning to understand the patient's perspective, beliefs, and concerns. Next, the professional should assess how these beliefs might impact the proposed treatment plan and explore potential conflicts or accommodations. Finally, a collaborative plan should be developed with the patient, ensuring they feel heard, respected, and empowered in their healthcare decisions. This process ensures that care is both medically appropriate and culturally sensitive. Question 15. Investigation of a patient's explanation of benefits, EOB, reveals a denial for a recently submitted claim. The patient contacts the clinic, confused about their financial responsibility. As a healthcare administrative professional, what is the most appropriate initial course of action to address this situation? Option A. Review the EOB thoroughly to identify the specific denial code and reason. Then communicate the findings and potential next steps to the patient and the billing department. Option B. Immediately resubmit the claim to the insurance company without investigating the denial reason. Option C. Inform the patient that the claim was denied and they are responsible for the full service amount. Option D. Advise the patient to contact their insurance company directly for clarification on the denial. The correct answer is A. Review the EOB thoroughly to identify the specific denial code and reason, then communicate the findings and potential next steps to the patient and the billing department. Explanation. This scenario is professionally challenging because it requires the healthcare administrative professional to act as a liaison between the patient, the provider, and the insurance payer, navigating complex billing and insurance processes. Misinterpreting an explanation of benefits (EOB) or a denial can lead to patient dissatisfaction, financial hardship for the patient or provider, and potential compliance issues. Careful judgment is required to ensure accurate information is communicated and appropriate actions are taken. The correct approach represents best professional practice because it prioritizes patient advocacy and accurate financial resolution. By thoroughly reviewing the EOB, identifying the specific reason for denial, and then communicating clearly with the patient and the billing department, the professional ensures that all parties understand the situation and can take the necessary steps to resolve it. This aligns with NHA's emphasis on ethical conduct, patient-centered care, and adherence to healthcare administrative standards, which implicitly require understanding and correctly interpreting insurance documentation to facilitate proper billing and patient financial responsibility. An incorrect approach that involves simply informing the patient that the claim was denied without further investigation fails to uphold the professional's responsibility to assist the patient in understanding their financial obligations and potential recourse. This could lead to the patient being unaware of appeal options or the provider not pursuing legitimate claims, potentially violating ethical obligations to both parties. Another incorrect approach, such as immediately assuming the patient is responsible for the full amount without verifying the denial reason, is a significant ethical and regulatory failure, bypasses the established appeals process, and unfairly burdens the patient. This directly contradicts the principles of accurate billing and patient financial counseling, which are core competencies for NHA-certified professionals. A further incorrect approach, like automatically resubmitting the claim without understanding the denial reason, is inefficient and unprofessional. It wastes administrative resources and does not address the root cause of the denial, potentially leading to repeated rejections and further delays in payment and patient satisfaction. This demonstrates a lack of critical thinking and problem-solving skills expected of certified professionals. Professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the EOB to understand the denial code and reason. Second, consult internal billing policies and payer guidelines. Third, communicate clearly and empathetically with the patient, explaining the denial and their options. Fourth, collaborate with the billing department to determine the next steps, which may include appealing the denial, correcting information, or informing the patient of their financial responsibility. And finally, document all actions taken. Question 16. What factors determine the appropriate steps for verifying insurance coverage and obtaining prior authorization for a patient's scheduled medical procedure, ensuring compliance with payer policies and ethical patient care standards? Option A. The specific insurance plan benefits, the payer's established prior authorization requirements for the procedure, and the provider's clinical judgment regarding medical necessity. Option B. The assumption that all services are covered by the patient's insurance and that prior authorization is rarely necessary for routine procedures. Option C. The patient's verbal confirmation of their insurance coverage and their expressed desire to proceed with the procedure. Option D. The perceived urgency of the medical procedure and the provider's general knowledge of common insurance practices. The correct answer is A. The specific insurance plan benefits, the payer's established prior authorization requirements for the procedure, and the provider's clinical judgment regarding medical necessity. Explanation. This scenario is professionally challenging because accurately verifying insurance and obtaining prior authorization are critical steps that directly impact patient access to care, financial responsibility for services, and compliance with payer policies. Failure in these areas can lead to denied claims, financial hardship for patients, and potential regulatory penalties for the healthcare provider. Careful judgment is required to navigate complex insurance plans, varying authorization requirements, and the need for timely communication with patients and providers. The correct approach represents best professional practice because it prioritizes obtaining accurate and complete insurance information from the patient, thoroughly reviewing the patient's specific plan benefits and coverage limitations, and initiating the prior authorization process according to the payer's guidelines and the provider's clinical necessity documentation. This aligns with NHA's emphasis on patient advocacy, accurate record-keeping, and adherence to healthcare regulations, ensuring that services are authorized before they are rendered whenever required, thereby minimizing claim denials and protecting both the patient and the provider from unexpected financial burdens. This proactive approach upholds ethical responsibilities to inform patients about their financial obligations and to facilitate their access to medically necessary care. An incorrect approach that relies solely on the patient's verbal confirmation of coverage without independent verification fails to meet professional standards. This is because patient understanding of their insurance benefits can be incomplete or inaccurate, leading to a false sense of security and potential claim denials. This approach risks violating ethical obligations to ensure accurate financial counseling and may lead to noncompliance with payer contracts, which often mandate verification and authorization procedures. Another incorrect approach that bypasses the prior authorization process based on a perceived urgency without following established payer protocols is also professionally unacceptable. While clinical urgency is a factor, payers have specific procedures for expedited authorizations. Ignoring these procedures can result in claim denials, even for medically necessary services, and may be viewed as a failure to adhere to contractual obligations with the insurance provider. This can also lead to issues with regulatory compliance if the payer's policies are considered part of the governing framework for reimbursement. A third incorrect approach that assumes all services are covered without verifying benefits or authorization requirements is a significant failure. This demonstrates a lack of due diligence and a disregard for the complexities of healthcare insurance. It directly contradicts the principles of accurate billing and revenue cycle management, which are fundamental to healthcare operations and are implicitly supported by NHA certification standards. This approach can lead to substantial financial losses for the provider and significant unexpected costs for the patient. The professional decision-making process for similar situations should involve a systematic approach. First, gather all necessary patient demographic and insurance information accurately. Second, thoroughly research the patient's specific insurance plan benefits, including copays, deductibles, coinsurance, and any limitations or exclusions relevant to the plan service. Third, determine if prior authorization is required for the specific service based on the payer's policies and the patient's plan. Fourth, if authorization is needed, initiate the process promptly, providing all required clinical documentation. Fifth, communicate clearly with the patient about their estimated financial responsibility. Finally, maintain meticulous documentation of all verification and authorization steps. Question 17. When evaluating a patient's understanding of their diagnosis, which involves a condition affecting the cardiovascular system, what is the most appropriate method for explaining the term myocardial infarction to a layperson? Option A. Referring to it as a sudden cessation of cardiac electrical activity leading to a loss of pulse. Option B. Explaining it as an acute event characterized by myocardial necrosis resulting from an imbalance between myocardial oxygen supply and demand. Option C. Describing it as a heart attack where blood flow to a part of the heart muscle is blocked, causing damage. Option D. Stating it is a condition where the heart's electrical conduction system malfunctions, causing irregular beats. The correct answer is C. Describing it as a heart attack where blood flow to a part of the heart muscle is blocked, causing damage. Explanation. This scenario is professionally challenging because it requires the healthcare professional to accurately interpret and communicate complex anatomical and physiological terminology in a way that is understandable to a patient, while also maintaining professional standards and adhering to NHA certification guidelines. The core of the challenge lies in bridging the gap between technical medical language and patient comprehension, ensuring informed consent and effective patient education. The correct approach represents best professional practice because it prioritizes patient understanding and autonomy. By using clear, concise language and offering opportunities for clarification, the professional upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, which can occur through misunderstanding. This aligns with NHA's emphasis on effective patient communication and the application of learned knowledge in real-world healthcare settings, which implicitly includes patient education and interaction. An incorrect approach that relies solely on technical jargon fails to meet the ethical obligation of patient education and can lead to patient anxiety, noncompliance, and potential medical errors. This violates the principle of beneficence and can be seen as a failure in professional responsibility, as it does not facilitate informed decision-making. Another incorrect approach that oversimplifies to the point of inaccuracy misinforms the patient, potentially leading to incorrect self-care or a misunderstanding of their condition, which is a direct contravention of ethical practice and NHA's focus on accurate knowledge application. Using analogies that are not universally understood or are potentially misleading can also create confusion rather than clarity, hindering effective communication and patient engagement. Professionals should employ a decision-making framework that begins with assessing the patient's current level of understanding. This involves active listening and asking open-ended questions. The next step is to translate technical terms into plain language, using analogies where appropriate and ensuring they are culturally sensitive and easily grasped. Crucially, this process must be interactive, allowing the patient to ask questions and confirm their understanding. The professional should then summarize the key information and confirm comprehension before concluding the interaction. This iterative process ensures that the patient is an active participant in their healthcare journey. Question 18. System analysis indicates a patient's adult child approaches a healthcare administrative assistant requesting detailed information about their parent's recent diagnosis and treatment plan. The child states they are helping manage their parent's affairs and need this information urgently. The administrative assistant is aware the patient is currently unable to communicate effectively due to their medical condition. What is the most appropriate course of action for the administrative assistant to take to ensure compliance with healthcare policies and legislation? Option A. Ask the adult child for their personal contact information and assure them that the healthcare provider will reach out to them directly with the requested information once it is deemed appropriate. Option B. Politely explain that patient privacy regulations prevent the disclosure of protected health information. Without explicit patient authorization or a legally recognized right of access, and offer to assist in obtaining the necessary consent or verifying legal guardianship. Option C. Share the patient's diagnosis and treatment plan with the adult child, citing the urgency of the situation and the child's stated role in managing the parent's affairs as justification for an emergency disclosure. Option D. Provide the detailed medical information to the adult child, assuming that as a family member assisting with affairs, they have an implied right to access the patient's PHI. The correct answer is B. Politely explain that patient privacy regulations prevent the disclosure of protected health information. Without explicit patient authorization or a legally recognized right of access, and offer to assist in obtaining the necessary consent or verifying legal guardianship. Explanation. Scenario analysis. This scenario presents a common implementation challenge in healthcare settings, balancing the need for efficient patient care with the stringent privacy requirements mandated by HIPAA. Healthcare professionals are often faced with situations where sharing information quickly is beneficial for patient outcomes, but doing so without proper authorization or safeguards can lead to significant legal and ethical breaches. The challenge lies in understanding the nuances of HIPAA privacy rule and security rule, and applying them consistently in a fast-paced environment. Correct approach analysis. The correct approach prioritizes patient privacy and compliance with HIPAA regulations. It involves obtaining explicit patient authorization for any disclosure of protected health information, beyond the minimum necessary for treatment, payment, or healthcare operations, unless a specific exception applies. This aligns with the core principles of HIPAA, which are designed to protect patient confidentiality and grant individuals control over their health information. By seeking authorization, the healthcare professional demonstrates a commitment to ethical practice and avoids potential violations that could result in penalties. Incorrect approach is analysis. One incorrect approach involves sharing the patient's detailed medical history with a family member without any form of patient consent or verification of their relationship to the patient. This directly violates HIPAA privacy rule, which restricts the disclosure of PHI. Without a clear legal right to access or explicit patient authorization, this action constitutes an unauthorized disclosure. Another incorrect approach is to assume that because the individual is a family member, they automatically have the right to access the patient's PHI. While family members may be involved in care, HIPAA requires specific conditions to be met before PHI can be shared with them, such as the patient's consent, or if the disclosure is in the patient's best interest and they are unable to consent. Simply being a family member is not sufficient justification for disclosure. A third incorrect approach is to provide the information because the family member claims it is for urgent medical reasons, without verifying the urgency or the individual's authority to receive the information. HIPAA outlines specific circumstances where information can be shared without authorization, such as in emergencies, but these are narrowly defined and require careful judgment. A blanket assumption of urgency without verification is a failure to adhere to these protective guidelines. Professional reasoning. Professionals should adopt a decision-making process that begins with identifying the information requested and the individual requesting it. They must then assess whether the request falls under routine treatment, payment, or healthcare operations, or if it requires specific authorization. If authorization is needed, the professional must obtain it in writing or through a documented verbal consent process that meets HIPAA standards. If there is any doubt about the legality or ethicality of a disclosure, the professional should err on the side of caution, consult with their supervisor or compliance officer, and prioritize patient privacy above all else. This systematic approach ensures compliance and upholds the trust placed in healthcare providers. Question 19. Compliance review shows a patient presenting to the clinic with acute abdominal pain, appearing visibly uncomfortable and guarding their abdomen. The medical assistant is tasked with obtaining a patient history and vital signs, which approach best aligns with NHA certification standards for patient care and data collection in this situation. Option A. Administer vital signs first, then gently inquire about the pain and its characteristics, offering comfort measures as appropriate before proceeding with further history. Option B. Ask the patient to rate their pain on a scale of 1-10 and then proceed with a standard non-tailored history without addressing their visible discomfort. Option C. Immediately begin a comprehensive, detailed patient history questionnaire while the patient is clearly in distress. Option D. Skip the patient history entirely, as the acute pain makes it unlikely to obtain accurate information, and focus solely on vital signs. The correct answer is C. Immediately begin a comprehensive, detailed patient history questionnaire while the patient is clearly in distress. Explanation. This scenario presents a common challenge in healthcare settings, obtaining accurate patient history when the patient is experiencing discomfort or distress. The professional's primary responsibility is to ensure patient safety and provide effective care, which necessitates gathering comprehensive and reliable information. The challenge lies in balancing the urgency of the patient's condition with the need for detailed and accurate data. The correct approach prioritizes the patient's immediate comfort and safety while still striving to obtain essential historical information. This aligns with the NHA's emphasis on patient-centered care and ethical practice, which dictates that a healthcare professional must act in the best interest of the patient. By first addressing the patient's immediate need for comfort and then systematically gathering information, the professional demonstrates empathy and professionalism, which are core tenets of NHA certifications. This method ensures that the patient feels heard and cared for, fostering trust and cooperation, which ultimately leads to better data collection. An incorrect approach would be to proceed with a lengthy, detailed history without first addressing the patient's evident discomfort. This fails to acknowledge the patient's immediate needs and can lead to inaccurate or incomplete information due to the patient's distress. Ethically, this demonstrates a lack of empathy and can be perceived as dismissive of the patient's well-being, violating the principle of beneficence. Another incorrect approach would be to entirely forego the patient history due to the patient's discomfort, assuming vital signs alone are sufficient. This is a significant regulatory and ethical failure. Patient history is crucial for diagnosis and treatment planning, providing context that vital signs alone cannot offer. Omitting this vital component compromises the quality of care and can lead to misdiagnosis or inappropriate treatment, directly contravening the NHA's standards for competent practice. A further incorrect approach might involve rushing through the history without proper clarification or confirmation, especially if the patient is in pain. This haste can lead to misunderstandings and errors in documentation, which are critical failures in maintaining accurate patient records and ensuring continuity of care. Professional decision-making in such situations requires a systematic process. First, assess the patient's immediate needs, pain, distress. Second, address those needs to establish a baseline of comfort and safety. Third, systematically gather essential information, adapting the approach based on the patient's condition. And finally, document all findings accurately and thoroughly. Question 20. Strategic planning requires a healthcare coder to accurately assign HCPCS level Roman II codes for supplies and services. When faced with a new or complex supply that has multiple potential codes, what is the most appropriate best practice approach to ensure accurate and compliant coding? Option A. Choose a general code that broadly covers the category of the supply if a perfectly matching code is not immediately obvious. Option B. Consult the official HCPCS level Roman II code set and relevant payer policies to identify the most specific and accurate code that reflects the documented service or supply. Option C. Rely on memory of common codes for supplies, as extensive experience should make precise recall reliable. Option D. Select the code that has been used for similar items in the past, assuming it remains appropriate. The correct answer is B. Consult the official HCPCS level Roman II code set and relevant payer policies to identify the most specific and accurate code that reflects the documented service or supply. Explanation. This scenario is professionally challenging because accurate HCPCS level Roman II coding directly impacts reimbursement, patient access to care, and regulatory compliance. Misrepresenting services through incorrect coding can lead to claim denials, audits, and potential penalties. Careful judgment is required to ensure that the chosen HCPCS level Roman II code accurately reflects the service or supply provided, adhering strictly to NHA guidelines and the specific payer's policies. The correct approach represents best professional practice because it prioritizes accurate documentation review and adherence to official coding guidelines. By consulting the HCPCS level Roman II manual and payer-specific policies, the coder ensures that the code selected is the most appropriate and specific for the service rendered. This aligns with NHA's emphasis on ethical and accurate coding, which is fundamental to maintaining the integrity of healthcare billing and preventing fraud or abuse. An incorrect approach that relies solely on memory or past practices without verification is professionally unacceptable. This fails to account for updates in coding guidelines, new product introductions, or changes in payer policies, leading to potential inaccuracies and non-compliance. It also bypasses the critical step of verifying the code's applicability to the specific documentation, which is a core ethical responsibility. Another incorrect approach that involves selecting a code based on what has been paid in the past without confirming current appropriateness is also a regulatory and ethical failure. Past payment does not guarantee current validity or accuracy. This practice can lead to systemic undercoding or overcoding, both of which have serious compliance implications. It demonstrates a lack of due diligence and a disregard for the evolving nature of coding standards. A further incorrect approach that involves choosing a code that is close enough, or a general code when a more specific one exists, is a failure to adhere to the principle of specificity in coding. HCPCS level Roman II codes are designed to be precise. Using a less specific code can misrepresent the service, potentially leading to incorrect reimbursement and an inaccurate picture of healthcare utilization. This violates the ethical obligation to code truthfully and accurately. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical record and all supporting documentation. 2. Identify the specific service, supply, or equipment provided. 3. Consult the current HCPCS level Roman II code set, paying close attention to any instructional notes or guidelines associated with potential codes. 4. Cross-reference with payer-specific policies and coding guidelines, as these can sometimes provide additional clarification or require specific modifiers. 5. Select the most specific and accurate code that fully describes the service or supply. 6. If ambiguity remains, seek clarification from a supervisor, coding manager, or the payer.